Greetings, knowledge seekers. Welcome to Brainetainment, your one-stop channel for all things fascinating and enlightening. Our mission is to bring you engaging content that stirs your curiosity, satisfies your thirst for knowledge, and broadens your perspective on the world around you. Today, we're peeling back the layers of a topic that's often shrouded in mystery and misconception: chlamydia. Prepare for an enlightening journey as we delve into the what, how, and why of this silent intruder. So brace yourself for an enlightening journey. Chlamydia, a word that might sound foreign to many, but it's a term we need to familiarize ourselves with. Chlamydia is a sexually transmitted infection, or STI, caused by the bacterium Chlamydia trachomatis. The name itself originates from the Greek word chlamydia, which means cloak, signifying how the bacterium can cloak itself within the human cells it infects. It's the sneakiest of STIs, often showing no symptoms at all, hence its nickname, the silent disease. Interestingly, chlamydia is not a new affliction. It has been with us for centuries. Historical records suggest that ancient civilizations like the Egyptians were aware of diseases that show similar symptoms to modern-day chlamydia. But it was only in the 20th century that the bacterium causing the infection was identified. Now, why is it important to be aware of chlamydia? Well, it's one of the most common STIs worldwide. According to the World Health Organization, there are an estimated 100 million new cases each year globally. In fact, in many high-income countries, chlamydia is the most reported STI. And here's the kicker: a significant number of these cases are in individuals who are unaware they have the infection due to its often symptomless nature. The prevalence of chlamydia is a public health concern. If left untreated, it can lead to serious health complications such as pelvic inflammatory disease in women, which can result in infertility. It can also cause epididymitis in men, a painful condition affecting the testicles. Furthermore, chlamydia can increase one's susceptibility to other STIs, including HIV. This makes it not just a health concern for individuals, but also a broader societal issue impacting public health on a large scale. As we can see, chlamydia is more common than we might think, making it imperative for us to understand it better. Now that we know what chlamydia is, it's crucial to understand how it spreads. Delving into the world of microscopic invaders, let's explore the transmission methods of chlamydia. This bacterial infection is primarily passed on through sexual contact, making it one of the most common sexually transmitted infections globally. How so, you may ask? Well, if a person who doesn't have chlamydia engages in sexual activity with someone who does, the bacteria can easily transfer from one to another. This can happen during vaginal, anal, or oral sex. What's even more intriguing is that it doesn't necessarily require full-blown intercourse for transmission to occur. Any genital contact can potentially spread the infection. That's right, chlamydia can be a sneaky little bugger. Now let's add another layer of complexity to this. Chlamydia can also be spread via shared sex toys if they are not washed or covered with a new condom before being used by another person. The bacteria can linger on the surface and hop onto the next user. But that's not the end of the story. There's another way chlamydia can be transmitted, which is from mother to child during childbirth. If a pregnant woman has chlamydia and it goes untreated, the bacteria can pass to the newborn as they travel through the birth canal. This can lead to complications such as pneumonia or eye infections in the baby. It's important to note, however, that chlamydia cannot be spread by casual contact, so sharing utensils, hugging, kissing, or even using the same toilet seat will not transmit the bacteria. The infection strictly sticks to certain intimate modes of transmission. Why does all this matter? Well, knowing how chlamydia spreads helps us understand how to prevent it. By practicing safe sex, getting regular STI screenings, and treating any identified infections promptly, we can significantly reduce the risk of transmission. Understanding how chlamydia spreads is the first step towards its prevention. And with that, we're on our way to combating this sneaky, silent invader. Chlamydia often goes unnoticed. Why? Because it's a sneaky infection. Let's delve into the signs and symptoms of chlamydia, an infection that often masquerades under the guise of silence. This bacterial invader, caused by Chlamydia trachomatis, can infiltrate your body without you even realizing it, earning it the notorious nickname, the silent infection. Now, why is it called so? Well, up to 70% of infected women and 50% of men may show absolutely no symptoms. That's right, they could be carrying the bacteria, potentially spreading it, and not even know they are infected. But when symptoms do manifest, they can vary greatly, often depending on the individual and the specific site of infection. For women, if the infection is in the cervix, symptoms may include abnormal vaginal discharge or a burning sensation during urination. Some women might experience lower abdominal pain, pain during intercourse, or bleeding between menstrual periods. In men, chlamydia typically infects the urethra. Symptoms may include discharge from the penis, burning sensation during urination, or in some cases, pain and swelling in one or both testicles. Less commonly, chlamydia can also infect the rectum, eyes, or throat, irrespective of gender. Symptoms here can include rectal pain, discharge, bleeding, or even redness, itching, and discharge in the eyes. However, it's important to note that these symptoms can be mild and easily mistaken for other conditions, hence the sneaky nature of this infection. This is why regular screening and checkups are so crucial, especially for sexually active persons under the age of 25 and those with new or multiple sex partners. Don't wait for symptoms to appear. Chlamydia is a sneaky adversary, but with regular testing, it doesn't have to be a silent one. Remember, no symptoms does not mean no infection. Regular checkups are key. Chlamydia might be sneaky, but it's not unbeatable. As we dive into the realm of treatment, let's not forget that early detection is crucial in the battle against chlamydia. After all, the sooner it's detected, the better the chances of a full recovery. In many cases, a simple course of antibiotics can effectively eradicate the infection. Azithromycin and doxycycline are two such antibiotics commonly prescribed by doctors, and they've proven to be quite effective in battling this sneaky bacteria. However, it's important to remember that treatment doesn't end with the elimination of the infection. Follow-up testing, usually 3 months after treatment, is recommended to ensure the infection has been completely cleared. Now let's talk about prevention. After all, it's better to avoid the infection altogether than to treat it, right? One of the most effective ways to prevent chlamydia is through safe sex practices. This includes using condoms correctly every time you engage in sexual activity, or opting for sexual activities that don't involve the exchange of bodily fluids. And yes, regular screening is also a part of prevention. If you're sexually active, especially with multiple partners, it's recommended to get tested for chlamydia annually. This helps in early detection and treatment, and also prevents the spread of the infection to others. Let's not forget the importance of open and honest communication with your partner or partners. Discussing your sexual health and history can be a vital step in preventing the spread of sexually transmitted infections like chlamydia. Finally, if you've been treated for chlamydia, it's crucial to inform any sexual partners so they can also get tested and treated if necessary. Remember, chlamydia can be passed on even if no symptoms are present. In the end, it's about taking responsibility for your health and the health of your partners. The more informed we are, the better equipped we are to make healthy decisions. Prevention is better than cure, especially when dealing with infections like chlamydia. We've learned a lot about chlamydia today, but the learning doesn't have to stop here. From understanding what chlamydia is, to how it spreads, how to recognize its signs and symptoms, to treatment and prevention methods, we've covered a plethora of information. But remember, this is just the tip of the iceberg. Sexual health is a broad and complex topic, and chlamydia is only one facet of it. It's vital to continue educating oneself, not just about chlamydia, but about all aspects of sexual health. This knowledge could be instrumental in safeguarding your health and the health of others. We live in an age where information is at our fingertips. Let's use it to our advantage. Read, research, ask questions, keep the curiosity alive. And while you're at it, why not make Braintainment your partner in this journey of learning? Our channel is dedicated to bringing you insightful and informative content on a variety of topics. By subscribing to Braintainment, you're not just joining a channel, but a community of curious minds on a quest for knowledge. So hit that subscribe button and let's make the world a more informed place, one video at a time. Knowledge is power, and here at Braintainment, we're all about empowering you. Don't forget to subscribe and join us on this journey of learning. Until next time, stay curious and stay informed.